Hello everyone, it is Kaitlyn from Psych Nurse Kate. I am officially here and ready to start this takeover, so please send me all of your questions about psych nursing, about being a healthcare professional with mental illness, anything like that. I would absolutely love to answer. So just as a little bit more background on me, I am currently a psychiatric RN. I specialize in psych intensive care, which is seeing patients with mania, psychosis, IDD with behavioral disturbances, neurocognitive disorders with behavioral disturbances, and I absolutely love it. It's fantastic. I have been practicing as an RN for 2 years, and prior to that, I was a nurse extern in psych for 3 years. So all in all, I've been doing work in mental health for 5 years total. For anyone that is interested in the mental health field, I think the role of a psychiatric nurse is so underrated. It is very challenging. You get so much interaction with your patients, which is one of the things that I love. And there's just so many different options. You can work inpatient, outpatient, and then of course you have the option to further your education and become a psychiatric nurse practitioner, which is a very growing field. So this person that asked this question says they went back to school to become a psych NP, and they only have experience working with patients that have Alzheimer's disease, and they want to know if I think they need more psych experience. This is a really difficult question to answer because it's so personal, but honestly, I think more psych experience is always a great thing because this field is so gray, and honestly, every single day I learn something new, which I feel like is typical for most areas of nursing, but it's just so much of what I learn is from what I see, seeing specific patient cases, and then once I see patients that have certain diagnoses, I'm able to go back, remember the patient, remember the treatment, remember the response, and I just feel like I really comprehend the diagnoses and the course of action. So my day has a very basic structure. It always starts with morning assessments and charting, morning med pass, and then meeting with treatment team. Psych is very collaborative, so nurses, social workers, physicians, therapists all meet in something called treatment team and discuss each patient and their treatment, as well as how they've been during their therapy sessions and just in general in the milieu. After that, the doctor's round, we get new orders, discharges, new medications, things like that. From there, we have groups, which I do not run groups. We have therapist groups and rec therapy groups where I work, but at some places, nurses do run groups. And then I kind of just like to describe my job as just like putting out little fires everywhere because you never know what's going to happen. You're always on your toes, and it's kind of just intervening and managing the milieu. So my specific position is in an inpatient setting because of the acuity. It's on a locked unit, so our patients are not allowed to leave the unit unless they are taken off of restrictions by the physician team. But yeah, it's totally an inpatient job, but psychiatric nurses work in different settings. They can work in residential settings. They can work in other units with lower acuity, think adolescent psych, So as you might have guessed, this is a very mentally draining job. There are so many systemic issues that make this a very difficult population to work with because it's hard to set them up for success outside of a hospital setting. That being said, I try to practice gratitude and do things that I enjoy when I'm not at work so that when I am at work, I can put my best foot forward and care for them in the way that they deserve. Okay, so let's chat about this a little bit. So the hospital I currently work at does separate patients by diagnosis. So we have an addiction unit, we have a general adult psych unit, and then we also have psych intensive care. Most psych units, and the unit that I worked on as an extern was just a general psych unit. It was all adult patients with all different kinds of diagnoses. And let me tell you what a blessing these specialized units are for milieu management. So why are specialized units such a big deal for milieu management? I will tell you. Imagine you're in the hospital. Maybe you're feeling very depressed and you get paired with a patient that's extremely high energy, maybe manic. Or you come into the hospital and you're actively withdrawing from opioids and you feel incredibly ill and your roommate is very confused, maybe experiencing some psychosis and thinks that you're out to get them. It's not there. So on the topic of psychiatric nurse specialties, Nurse.org has this really nice article about being a psychiatric nurse that highlights some of the places you may practice. And the need with these is huge. Community mental health, we need so bad. Hospitals, like what I do, private practice, rehabs, prisons even, so many. And while we're on the topic, the need for psychiatric nurses is so incredibly great. You can see that from 2020 to 2030, the field is expected to grow by 9%, and I honestly think that is a low estimate. Not only do we lack resources, but we lack interested nurses. So that's why it's so important to teach people about this specialty and all of the amazing opportunities it has to offer. So I will always be pro new grads starting in specialties regardless of what it is. But I think this is one of those things that varies so much depending on who you ask. But I started in psych as a new grad 2 years ago, and I'm so glad that I did. I knew that was my passion. I knew that's where I wanted to be. And I think that's helped so much with me not burning out as a nurse. I was actually offered a new grad med-surg position on a long-term IV antibiotic unit, which would be dealing with a lot of patients struggling with addiction, with endocarditis, and I very much considered taking it because so many people told me I needed that medical experience first. And thank God I did not. I just don't think that's where I'm meant to be. Like, I do okay in med-surg, but it's not where I thrive for sure. So to this I say, just like medical units, all psych units are not created equal, and you are going to the interview and you need to be screening, making sure there's security, making sure there's safe ratios, etc. And the vast majority of patients I take care of, even in psych intensive care, are not homicidal and they're not violent. So this is one of those stereotypes, unfortunately, that keeps people from working in the field. Alright, you guys, it's pretty much the end of my time here on Nurse.org. I very much enjoyed doing this takeover, answering some of your questions, and spreading awareness about the wonderful specialty of psych nursing. If you wish to continue following me, you can find me at Psych Nurse Kate on both Instagram and TikTok. So please catch me over there and keep sending me questions.